Okay, now we're going to continue by looking at the wrist and the carpal bone anatomy. The carpal bones are aligned along the wrist in two rows. We have the proximal row right here, articulating with the radius and the ulna, forming the radiocarpal joint. And the proximal and distal carpal bones articulate with each other to make the midcarpal joint. These two joints are very important for wrist flexion and wrist extension. And it's also partially important for radial deviation and ulnar deviation. Okay, now we're going to take a look at the proximal row. So in the proximal row, we have the scaphoid right here. Okay. We have the lunate, the triquetral, and the pisiform. In the distal carpal bones, we have the trapezium, trapezoid, capitate, and we have the hamate. Now we're going to take a look at the carpal tunnel. The carpal tunnel is located in this area. Okay. So the carpal tunnel is located in this area, and the following carpal bones, such as the pisiform, the hamate, the scaphoid over here, and the trapezium, create the borders of the carpal tunnel and the areas in which the flexor retinaculum connects to make the roof of the carpal tunnel. The following structures enter the carpal tunnel before inserting on the digits. So first we have the flexor digitorum superficialis, then we have the flexor digitorum profundus, and also the flexor pollicis longus of the thumb, and lastly the median nerve. A common median nerve compression at the carpal tunnel is known as carpal tunnel syndrome in this area. This can be tested by the median compression test, where the examiner will compress the median nerve at the carpal tunnel while flexing the wrist. If this is positive, it will provoke tingling and numbness at the thumb, the pointer, the middle finger, and only the radial side of the ring finger. Another carpal tunnel test is known as the Phalen's and reverse Phalen's test. The Phalen's test is done by having the patient flex the wrist with both dorsal sides touching for approximately 1 minute. If tingling or numbness is elicited, this is positive for carpal tunnel syndrome. The reverse carpal test also is used for carpal tunnel, and the patient holds hands in prayer position. Next, we will take a look at the Guyon's canal. The Guyon's canal encases the ulnar nerve, which passes around here, and the ulnar artery, as well as the tendon of the flexor carpi ulnaris. To test for ulnar nerve compression at the Guyon's canal, we will perform Tinel's test and compression at the ulnar nerve. If positive, the client will experience tingling or numbness at the ulnar and radial side of the pinky, and also the ulnar side of the ring finger. Now we will look at wrist instability. We will do a Watson scaphoid shift test for scaphoid instability. Right here. We will first place our thumb at the scaphoid tubercle right here, while going from ulnarly deviated to radially deviated and pushing the dorsal side on the tubercle. Any popping will indicate a scaphoid instability.